And 98.3 FM, the sound of Lagos. This is, of course, the final episode of the show for the year 2023, and this is the final segment for the year 2023. You know, from every Friday, 10 a.m. to 11:30 a.m., we bring to you health conversation in hopes that it informs you and helps you make better decisions about things like your diet, your physical activities, mental activities, or basically your overall physiological and psychological health. And aside from all of the above, another objective of the show, of course, is to keep you abreast of epidemics, disease outbreaks in different parts of the country, to educate you on the best preventive techniques, also how to care for affected individuals, and most importantly, how to mitigate the spread of these particular outbreaks. Well, today on Health Plus, we are going to be doing exactly that, as we are going to be discussing an outbreak that is currently ravaging the people of Sokoto State. The conversation today is on dengue fever, with Sokoto State in perspective. Now, recently, the Nigeria Center for Disease Control and Prevention did confirm the outbreak of dengue fever in Sokoto State, and that was on Saturday, I believe, the 16th of December, this very year. And the NCDC, in a statement that it posted on its website, you can go and check that, they said the outbreak was actually detected in November of 2023, but a confirmation, of the outbreak was on the 16th December 2023. And as at the time of the announcement, there were about 71 suspected cases, there were 13 confirmed cases, and there have been 0 deaths recorded so far in the state, and 3 local government areas have been the most affected with dengue fever, although efforts are currently being made by relevant stakeholders to curtail the prevalence of dengue fever in the state. So for the next 40 minutes or thereabout, we're going to be discussing dengue fever, the causes, the signs and symptoms, the diagnosis, the treatment and prevention, amongst other things. Also, we are going to dialogue on the regions where dengue fever is more prevalent, the precautions that individuals should take when going to these areas. And I am quite pleased to announce to you that for this exchange this morning, we are going to be joined virtually by Paul Labaran Majam. He is the national focal person for the Risk Communication and Community Engagement Pillar on Emerging Viral Hemorrhagic Diseases Technical Working Group at the Nigeria Center for Disease Control and Prevention. That's the NCDC headquarters in Abuja, so we can get first-hand information. Paul Labaran Majam is already on standby for the conversation on dengue fever. It's such a pleasure to have you, sir. Good morning to you.
Thank you, Sage. I believe I'm speaking with.
Yes, you are speaking with Sage. Thank you so very much for joining us, and I definitely appreciate the fact that we do have someone from the NCDC to talk to us about dengue fever and the situation in Sokoto State. But before we begin to speak specifically on the events that are playing out in Sokoto State, I think it would be wise for us to first familiarize people with this particular infection that is dengue fever. So can we please start by you explaining to us what dengue fever, this particular infection, what is it all about?
Okay, thank you once again, Sage, for this opportunity to talk with you and with your audience or our listeners, to educate them, to let them know, understand what is happening in Sokoto State, and particularly to educate them about what dengue fever is all about. So first of all, let me say simply, dengue fever is a viral infection, okay, caused by the dengue virus, which is abbreviated as dengue. Okay, that is what basically this fever is all about.
I'm sorry, I'm not sure we quite got you.
Okay. Oh, sorry. Am I audible now?
Yes, you were audible, but we're not really able to pick out your words. If you'd be kind enough to please come again. Thank you.
Okay. So, like I said, dengue fever is a viral infection, okay? It's transmitted, or let me say, mosquito.
All right.
Possible for dengue, a particular species of the mosquito.
To believe that the mosquito activities of the mosquito is
same as malaria, even though they have but they are quite different.
All right then. So the mosquito is the vector for dengue fever, just as it is. Thank you very much for the clarification. And of course, it's a no-brainer that for the mode of transmission, the malaria, the mosquito, I beg your pardon, is the primary mode of transmission. That is how we go. That's how people can get infected if the mosquito actually bites an uninfected person. So let's talk about the risk factors. What are some of the conditions that increase the susceptibility of people to getting infected with dengue fever? Is it based on your environment? Is it based on certain activities of the person or the demographic? What exactly causes a person to be more susceptible to being infected with this dengue fever?
Well, like actually, first of all, yeah, you let's give it to the environment, okay?
Okay.
Like yeah, when there's no proper sanitation, when there are water logs or water bodies around people, dirty water, mosquito breeding, when there are breeding sites for mosquitoes among the people or in the society, in the community, definitely it gives rise to this outbreak. Especially, like like I was trying to be categorical that this mosquito, this particular species of mosquito causing this infection is Aedes mosquito. Okay, and it is the type of mosquito that bites in the early hours of the morning or late hours of the evening. Okay, so that
is just joining us. We are having a conversation about dengue fever before there's already intervention in place to mitigate the prevalence of dengue fever. And I do community engagement pillar on emerging viral hemorrhagic diseases technical working group at the Nigeria Center for Disease Control and Prevention NCDC headquarters in Abuja. And we're asking questions about dengue fever, what is responsible for the fever, how it's spread from person to person, and factors that increase people's susceptibility to suffering from dengue fever. I think we cannot talk about the malaria fever also presents, but are there distinctive signs and symptoms of dengue fever that you would like to highlight?
Okay, so talking about specific signs and symptoms of dengue fever, a mild or no, in fact, at times you might not even have symptoms. Okay, but those symptoms are usually they occur or in such a way that one gets better, okay, from the infection within between 1 and 2 weeks, okay. So but really, okay, dengue can be severe, okay, and lead to death. That's why we want to actually let people know that there's no reason for panic, because it really is become the only severe instance is severe. It's when one contacted or is infected for the second time with it. That is when it becomes severe. But then usually we're based on science. What we have seen so far, what data has shown us so far is it doesn't lead to death. Okay, if symptoms occur, they usually occur within 4 to 10 days after infection, and then they last in the body for 3 to 7 days. Okay, these symptoms again may include high fever, which is in the range of 40 degrees Celsius to 104 degrees. Okay, so there is severe headache, there is pain behind the eyes. Okay, there is also muscle and joint pain. At times it could also lead to swollen glands and rashes. Okay, and these symptoms, they don't stop there. They also include, like I said, when one is infected, they also include nausea. They include at times vomiting. Okay, so these are some of the symptoms that clearly show that one is infected with dengue.
Right. Can dengue fever open the pathway for other diseases, especially if left unmanaged? Is it possible that there are severe complications that can arise from dengue fever? Because like you said, there are some people that are asymptomatic. They might not even experience the symptoms, immediately, right? But and the symptoms are familiar symptoms, the nausea, the vomiting, they are familiar symptoms. But is it possible that if left unmanaged, dengue fever can actually lead to more severe complications?
Well, for now, we are still studying what the other complications involved with the disease. So, but for now, science has not shown us if dengue fever opens up those that come down with it to other infections.
All right. So let's discuss Sokoto State. Like I said, I just wanted us to lay a general foundation for us to build on Sokoto State. Earlier in my intro, I did highlight that the announcement made by the NCDC about the 71 suspected cases of dengue fever, 13 have been confirmed, and so far, I think 0 deaths have been reported in the state from 3 local government areas. First, I would like to confirm with you, since you're a person that works directly with the NCDC, has there been an increase or maybe a decrease in these figures? Have we seen an increase in reported cases? Have we seen an increase in confirmed cases? Or maybe a number of deaths have been recorded? Or are we seeing a decrease of these figures? What is the situation with the number of affected persons?
Well, first of all, I like the public to understand that Nigeria Center for Disease Control and Prevention is aware of this outbreak of dengue fever that has been reported in Sokoto State since November, like you have reported, okay? And they need to also understand that Nigeria as a country has an adequate public health system to diagnose and respond to cases of dengue fever without any challenge, okay? So based on the dynamic risk assessment that has been carried out, okay, the current risk level of this outbreak in Sokoto State has been determined as moderate. Moderate in the sense that there is no any till date, the detection of the outbreak till date does not show any severe case or even death. Okay, so that is the reason why Nigerians should not panic, okay, about this. And then coming back to your question, yes, we have been monitoring the situation in Sokoto, and like you said earlier, or let me say, the first report we got from colleagues in Sokoto was that the outbreak happened. They had 63 suspected cases, okay, and these cases were distributed among Sokoto South, Wamako local government area, and then Wᴏùᴜᴜ local government council as well. So, and we have been looking what is going on, and the colleagues have been treating the cases. Okay, even though out of these cases, eventually we got to 71. Okay, from 63 to 71 cases, and these cases, out of them, I think 13. Okay, initially it was 13 that were confirmed to be positive, and then later on an additional one was also added to the number of the positive cases, which has brought it now to 14 positive cases. So, but the good news is these cases have been well managed, okay? Because some people might recall that in 2019, 2016, and 2019, Sokoto State had this outbreak, okay, and it was well managed. So it's not that the manpower, the skill, the skill to manage this, the technical know-how to manage this is with us, and because of that, the people should not panic because we are the situation.
Right, we are streaming live on Facebook and YouTube, so if you would like to participate on the program, you probably have questions, you want further clarity on dengue fever, you want more answers about the situation in Sokoto State, amongst other things, you can definitely interact with us via our streaming platform. We're live on Facebook discussing dengue fever with emphasis on the situation in Sokoto State. I do have a representative of the NCDC with me virtually in the studio. Paul Labaran Majam has been talking to us about the efforts of the NCDC in managing this particular outbreak in Sokoto State, considering the fact that it's not the first time, and I believe from the first incidents, certain techniques have been put in place to control a serious spread of, or prevalence, if you like, since it's not exactly a communicable disease, the prevalence of dengue fever in Sokoto State. So please go to our Facebook platform. We're streaming live. You can join us. You can take advantage of the live chat option that is on Facebook. Type in your question, type in your suggestions, type in your contributions and I'll read them live on air. My name is Sage Babalola. You're listening to Health Plus on Mainland 98.3 FM, the sound of Lagos. And like I said, the conversation is on dengue fever with emphasis on the situation in Sokoto State. All right, moving back to conversations. Now, let's talk about state management protocol for dengue fever management. Like you said, it has happened before in Sokoto State. And before you even talk to us about state management protocol, I would like for you to first help us understand why there's a recurrence in Sokoto State. Why is Sokoto State vulnerable to dengue fever? Is this a population issue? And this is me assuming, just consider this an assumption of some kind to drive the conversation. Is this a population issue? Is this something of maybe public hygiene, amongst other things? Why exactly is Sokoto State among the other states that are also susceptible? Why is there a recurrence of dengue fever in the state? What exactly is happening with that?
Well, the issue is, yes, the issue of population is there, okay?
Yeah.
And then, but especially it is, and then you allow, okay, the proper care, and there's no way the environment will have mosquitoes or breed mosquitoes, and people will not come down with disease to protect, to see how to stain it. But the challenge is, after this efforts of government, what do the people do? Do they continue to maintain proper hygiene? Do they continue to use mosquito net or insecticide treated mosquito net? Do they own this intervention of government and see how to sustain it? Even after the outbreak, people don't. It is like the moment it happens like this, and government steps in, and everything comes out fine. Nobody comes down with it again. The infection is curtailed. It is not that everybody relaxes himself or herself, and nobody cares again to continue to do those things that they have been shown to do to curtail or to keep this outbreak at bay. So that's why we have this fight at intervals like this.
All right. Thank you for that. We're still going to talk further on it as we proceed with the conversation, but help us with an understanding of the state management protocol for dengue fever. Or if you like, you can even talk to us about state management protocol in controlling or curtailing epidemics like this one or disease outbreak like this one. Once there are a significant amount of reported cases about, say, the outbreak of a disease, what exactly are the steps that, stakeholders in the health sector of each state, what exactly are the protocols that they are supposed to immediately invoke to manage the situation?
Well, what we do, okay, is reporting to surveillance officers. Okay, we have surveillance officers in all the 774 LGs in the federation, and these are our officers that go around communities, they go around health facilities, monitoring what is going on. So, and what the state does is we encourage that once one has symptoms, okay, they should report to these officers, or they even report to health facilities, because there's no way they will report to a health facility and that case, that infection will not be picked up. Definitely, we also have our system, we have the summer system, we have the EBS, we have so many, we have quite a number of systems on ground that pick these cases for us. And that is why the moment it happens like this, it gets to us, even in Abuja. And then we begin to follow up with colleagues at the state level to see what they are doing. And if perhaps they lack the manpower, okay, we are always ready to support. Okay, so those are some. And then our clinicians, of course, have to maintain a high index of suspicion, because when they see these cases, they might at times they might mistake them to the malaria fever, which is not. Okay, and that is why we encourage that they maintain a high sense of suspicion, so that when these cases come to them, they can easily dictate and also differentiate which is which, so that we initiate support.
All right. So I'm going to take you back to the conversation we had about the attitude of the people, because earlier I asked that why is there a recurrence of dengue fever in Sokoto State, for example, considering the fact that it has happened before. The government have stepped in, they've helped to prevent, the consequences from being too dire. They've helped with treatment amongst other things, but for some reason it keeps recurring. And you highlighted that the attitude of the people after they succeed, that particular phase is what causes a recurrence. But then, for example, waste management, are there any specific things that the government do regarding waste management? The drainages, are there certain things that the government do regarding making sure that the drainages are not clogged, the water is flowing? Are there officials who go around street to street, local government area to local government area, maybe on a weekly basis, on a monthly basis, to check the environment, to ensure that people are following the rules and regulations of environmental management, and maybe punishments put in place for those who contravene? Are things like that being done? Is there a monitoring team? I think that's the best way to describe this. Is there like a monitoring team, organized by the government, that goes around maybe on a monthly basis, especially in states that are susceptible to outbreaks, to ensure that we don't see things like this and hold the people accountable, especially when it comes to managing their environment?
Okay. The issue is, yes, I agree that this is a social developmental issue. Okay. So, but the issue, what we need to understand at this point is, these issues are actually at the doors of the state government. So federal government cannot do everything. That is why we usually indulge we usually take indulgence of the state government to be up and doing, so that these things don't just stop at the federal government. Is at the top. Okay, federal government is not at the grassroots. It's the state government and the local governments that are at the grassroots. So it is not that whatever intervention we are initiating, okay, or giving the state government, it's not everything we will do. For example, what we do is we can support them with some. Perhaps they don't have the manpower or the technical know-how, okay, how to go about this infection. We support that. We also support with countermeasures. Okay, so those are the things you do, but it is the responsibility of the federal government to initiate sanitation practices. Okay, the monitoring, the evaluation, the punishment, the discipline, or whatever that they feel they could do in order to complement what we are supporting them at the federal level.
So that responsibility should fall on the state government, local government chairman, the councillors, amongst other things, to go to these streets, go into the community, and ensure that people are obeying environmental laws. All right, thank you very much for that. So now let's talk about the effort of the federal government now, right? Since we now understand what the responsibility of the state government is, the responsibility of the federal government, what efforts specifically, does the federal government put in place to control outbreaks like this one? When the state, for example, reaches out to the federal government, okay, we have reported a number of cases like this one. Let's use dengue fever, for example, as that is the subject of conversation. We've seen, this amount of dengue fever in the state. We need you to step in. What are the provisions specifically that the federal government puts in place in order to help the state carry out their own part in mitigating the spread of these infections?
Okay, so first of all, when there is an outbreak like this, okay, and dengue fever, to be specific, hence we are talking about the outbreak of dengue fever in Sokoto State.
Yeah.
So what the federal government, through the Nigeria Center for Disease Control and Prevention, has done and is still doing, first of all, is the activation of the Incident Coordination Center, ICC. Okay, so this center has now been activated and is in an alert mode. Okay, meaning that we are already, our ears are already on ground because of this, and our eyes, are everywhere. Okay, monitoring everything and also listening to what is going on, so that just in case there is we have developed an emergency incident action plan for this infection. Okay, it has already been done. Then we have also reviewed the case definition for the dengue fever. Okay, then not just these steps, we have even gone ahead. Okay, as the National Emergency Center. Okay, we have sent out warning notifications to all subnational public health emergency operation centers all over the country to be on alert because of this outbreak, because this is a festive season. Okay, where citizens, residents will be moving, traveling across the country for celebrations with their loved ones, and of course, diseases, the outbreak is not a matter of how, okay, but it's a matter of when, because it takes someone to travel, it takes someone to move from one point to another for it to happen. So that necessitated us to send a warning notification, okay, to all our PHDOCs across the nation. Then we are also following up suspected cases that have been confirmed. Okay, we have since commenced the follow-up of those suspected cases. We have also taken our rapid response teams and on standby, okay, to be deployed in an event of a nationwide outbreak. Okay, we also have, like I mentioned to you earlier on, a medical countermeasures plan has been initiated already. Okay, just in case of any nationwide outbreak, then we swing into action. Then dissemination of public health advisory to the public and the media, okay, has already been done. I want to believe that it is because of the press release that most of the media houses like mainland to also reach out to us. Okay, and then we also have a risk communication and engagement strategy, okay, that has been developed to strengthen preparedness activities, which include a review of risk communication protocols, plans, and messages in the event of a wider outbreak. You find like in SOKOTO at the moment, there are radio jingles, there are public service announcements that are being done, by the media, just to see how to help the public, okay, to be aware of what is going on, and also tell them the things they need to do to stay healthy, okay, and to stay safe from this outbreak. Then there is also a proposed research project with the National Arbovirus and Vectors Research Center across the geopolitical zones of the Federation to better understand the disease vector. If you could recollect, I told you that, we are still trying to understand some things about the virus. So that is why it's not everything that we can tell you that is happening, especially the nature of the disease. Okay. Then Nigeria also, as a country, has an active infection prevention and control program nationwide with guidelines and training packages well developed for health care workers, just to see that nothing escapes our net. When it comes to infectious diseases like dengue fever.
Well, that's a very extensive plan, from the federal government. But then you've spoken about prevention. You've spoken about the monitoring team. You've also spoken about, the boots on the ground, the ones who go around in making sure that those that have been, affected are being brought in. But then you haven't really said anything about the treatment. Those that have been affected, I would like to believe that there's a plan for treatment to be made available to them. And also, I would like to go out of my way to ask about the cost of treatment. Are people who have been affected, expected to pay, because these are federal government in collaboration with the state government initiatives to cater to those who have been infected? So the treatment plan for these people, first things first, are they supposed to pay something for this treatment? How about, the feeding these individuals before they're allowed to go back into society, amongst other things? Is all of this covered by the federal government, or there's some sort of, pay that is expected from the people?
Okay, usually during outbreaks like this, the countermeasures plan, okay, we put on ground takes care of the patients, okay, of the people that come down with these infections, meaning that they don't have to pay for the treatment.
Okay.
And again, it is important at this point for you to know that we work in collaboration with state government, because we can't dictate to the state government what they should do.
Right.
But we give our support, and the drugs we supply the state to support in support of them, okay, to support them in the treatment of the patients are free of charge. Okay, we give them drugs that should be given to patients free of charge. And then what you need to know is that there is no specific treatment for dengue fever. Okay, the only let me say measure that is taken, the preventive measure is taken, is the fact that early detection and prompt initiation of supportive treatment is what has shown, okay, that is a lot has shown to significantly reduce the serious infection. Okay, when there is an early detection, when there is a prompt initiation of supportive treatment, we discover that patients don't have to take too long to recover from the infection.
All right, thank you very much. Again, I know you've spoken about this, but before I let you go, I'd like for you to once again emphasize on the advocacy and sensitization. I know that it doesn't just have to be in the affected states. It's important that people know ahead of time. For example, you've told us that 4 days after infection, that is when signs and symptoms start to manifest, which is vital information, so that when people see these signs, they probably would know, okay, something is wrong, I need to approach a healthcare facility. So please talk to us, or reiterate rather, advocacy, sensitization efforts, the things that, or where people can go if they want information, accurate information, because there's a lot of misinformation out there online. So if people want accurate information about dengue fever, or maybe even any other infectious diseases, where exactly can they go to get this accurate information?
Okay, thank you very much, Sage, again for this question.
Yes.
So, like, what people need to know about what to do, okay, when they have these symptoms, is for them to immediately report to a health facility, the one very next to them, so that, because people should avoid self-medication. Okay, yes, because you discover that at most times when people notice these symptoms, what they do is they go to the next available patient medicine store, or the usual chemist store that is on the street next to them, and begin to purchase drugs for consumption, which is not correct. So what we advise is, people, once you have symptoms like this, okay, take that pain to reach out, take that pain to go to the next available facility for proper diagnosis and supportive care. Okay, then people, again, if people can, if maybe you are unable, okay, to do that, you can simply call NCDC on 6232, okay, for supportive care, or for advice on what to do. Or you could even call the dedicated hotlines provided by state ministries of health, okay, to ensure that all persons with suspected symptoms of dengue fever are described, like in our conversation earlier, okay, are promptly taken to designated health care facilities, okay, by responsible state ministry of health for prompt diagnosis, like I said, and also for initiation of supportive treatment. That is what is expected, or that is what is advisable for to people to do.
Thank you so very much. It's been more than a pleasure having you join us on radio. We did talk to Paul Labaran Majam. He is the national focal person for the Risk Communication and Community Engagement Pillar on Emerging Viral Hemorrhagic Diseases, the technical working group at the Nigeria Center for Disease Control and Prevention, that's the NCDC headquarters in Abuja, and he joined us to talk to us about dengue fever. We put a lot of spotlight on Sokoto State because that is where there's something of an outbreak at the moment. But just like you heard from Paul Labaran Majam, the NCDC have immediately swung into action trying to control the spread of dengue fever, and they're currently helping those who have been infected to get through the proper treatment plan. You've heard it. The minute you start to feel these symptoms, or the minute you get these symptoms, report to a healthcare facility. All of these reports is what is going to prompt the notification that would be sent to relevant stakeholders so that they can immediately swing into action and prevent it from becoming a national issue. Thank you so very much once again for joining us, sir. We appreciate your insight into the matter, and it's even more interesting that we're able to hear directly from the horse's mouth. Have a wonderful day, enjoy the rest of your holidays, and I look forward to talking to you again soon.
It's a pleasure, Fitch. Thank you very much.
Yes, have a nice day. Thank you. All right, there you have it. Paul Labaran Majam, he spoke to us. He is a representative of the NCDC, that is the Nigeria Center for Disease Control and Prevention. We spoke to him. He actually is in Abuja, so that is more or less like a federal government thing. And it's good we were able to talk to someone from the federal government so that they can talk to us about what the responsibilities of the federal government are, the responsibilities of the state government, and maybe even the local government, and all of the work or the collaboration that they have to do in managing outbreaks like this one. So just like you heard, in Sokoto State, the situation is slowly starting to get under control thanks to the intervention of the relevant stakeholders, the NCDC for one, who actually were the ones who made the initial announcement, on the 16th, announcing that there is an outbreak of dengue fever, but everything is under control at this time. And luckily, we have not recorded any death from dengue fever because quick detection is probably the easiest way to manage said dengue fever. Well, that's it for Health Plus, actually for the year. This is the final Health Plus for the year 2023. It's been such a ride, and it's been more than a pleasure, especially for me coming on radio, knowing that there are people who are waiting to hear me speak, waiting to hear what I have to say to them about their health. And it brings me so much joy to have been able to serve in my capacity on the show for the year 2023. It's been so great. I feel like at this time I might as well go and get a degree because, I'm a doctor, because I have spoken to knowledgeable people in the health sector, and I have been impacted in the same way that I would like to think you, our listeners, have been impacted. So until next year, 2024, we get back to having health conversations. I really, really hope that we've been able to help you make wise decisions about your health, both physiological and psychological. And remember that we are always open to take your contributions. If you notice something, you need help contacting the appropriate agencies, all you have to do is go to our social media platforms, state what your concern is, and I can assure you we can connect you to the appropriate authorities. So please be safe, stay safe until the year 2024. We'll be back at it again. This is it for Health Plus on Mainland 98.3 FM. At 11:30 a.m. I'll be back to read to you the news headline. At 12, you get the full bulletin. Sage Babalola is my name. Enjoy the rest of the show.